HESI A2 Grammar Practice Test 2025. Question 1. Identify the correct spelling. Hemorrhage, 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 hemorrhage. Hemorrhage has double R then H. A, C, D are misspellings. Question 2. Which pronoun correctly completes? It was underscore 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 who called the code. Me, him, her, she. Subject of was equals nominative she. A, B, C are objective. Question 3. Spot the error in. The patient's vital signs was recorded every hour. Patient's vital signs was recorded every hour. Subject signs plural were recorded, not was. A, B, D are correct. Question 4. Which sentence uses the colon correctly? The patient needs fluids, rest, and medication. The patient needs fluids, rest, and medication. The patient needs three things: fluids, rest, and medication. The patient needs fluids, rest, and medication. Colon after independent clause introducing list. A colon after verb, B colon mid-list, D colon after subject. Question 5. Choose the correct conditional. If the nurse underscore 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 earlier, the patient would have gotten a bed. Would call, called, had called, has called. Past perfect had called for unreal past condition. A equals future, B equals simple past, D equals present perfect. Question 6. Which word is a conjunction in she is kind and professional? She is and professional. And joins kind and professional. A pronoun, B verb, D adjective. Question 7. Select the sentence with correct their usage. They're going to discharge him soon. 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 Their equals they are. A equals possessive, B equals location, D missing apostrophe. Question 8. Which sentence maintains consistent tense? The patient coughs and then complained of chest pain. The patient coughed and then complains of chest pain. The patient coughs and then complains of chest pain. The patient coughed and then will complain. Both verbs present tense, coughs/complains. A mixes present/past, B past/present, D past/future. Question 9. How would you correct? Being a nurse, compassion is essential. Being a nurse, essential compassion is. For a nurse, essential compassion is. A nurse, compassion is essential for one. For a nurse, compassion is essential. Original has dangling modifier. D rephrases clearly. A and B awkward, C wordy. Question 10. Which word is a preposition? The syringe is on the counter. Syringe is on counter. On shows relationship between syringe and counter. A noun, B verb, D noun. Question 11. Choose the correct degree of comparison. This is the underscore 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 pathway of all. Short, shorter, most short, shortest. Superlative, shortest for three or more. A positive, B comparative, C awkward. Question 12. Identify the sentence with correct use of an. She had an history of falls. She had an honest explanation. She had an unique symptom. She had an usual reaction. And before vowel sound, honest equals onest. History A equals consonant sound, unique C equals U, usual D equals U. Question 13. Which option correctly changes to negative? Someone is in the room. No one is in the room. Anyone is not in the room. Not someone is in the room. No one are in the room. No one plus singular is correct negative. B ungrammatical, C incorrect, D subject-verb agreement error. Question 14. Select the correctly punctuated list. The cart contains gauze, tape, scissors, and gloves. 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 Serial comma before and is optional but correct in A. B missing final comma, acceptable but less clear, C no commas, D colon unnecessary. Question 15. Which sentence avoids a split infinitive? She needs to carefully monitor the drip. She needs carefully to monitor the drip. She needs to monitor the drip carefully. To carefully monitor is her goal. To monitor carefully, no split infinitive. A, D split, to carefully monitor, be awkward. Question 16. Choose the correct pronoun. Everyone in the class finished _______ exam early. There. His or her. There. Them. Everyone singular, his or her. Their A common but less formal, C contraction, D objective. Question 17. Which sentence uses imply correctly? The symptoms imply an infection. From the fever, I imply pneumonia. The lab results imply the patient must rest. The doctor inferred, but did not imply, the diagnosis. Imply equals suggest indirectly. Symptoms suggest infection. B should be infer, C awkward, D correct use of infer. Question 18. Identify the correct spelling. Accommodate, 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 accommodate. Accommodate has double C, double M. A triple M, B single M, D missing one C. Question 19. Which option corrects? The reason is because the vein collapsed. The reason is due to the vein collapsed. The reason is that the vein collapsed. The reason is because of the vein collapsed. The reason being the vein collapsed. Reason is that is correct. Reason is because is redundant. A and C still awkward, D fragment. Question 20. Select the sentence with correct hyphen use. The patient is well known in the unit. The well-known patient is in the unit. The well-known patient is in the unit. The patient well-known is in the unit. Hyphenate compound adjective before noun, well-known patient. A no hyphen after noun, B missing hyphen, D awkward.